So my name is Hillary Oliver, and I'm a student of Dr. Spires. My topic of choice was Alzheimer's disease and the psychological effects it has on family members. The definition of Alzheimer's is a progressive mental deterioration that can occur in middle or old age due to generalized degeneration of the brain. It is the most common cause of premature senility. Statistics. It is very common, with more than 5 million U.S. cases per year, with the most ages affected is 60 and above. Diagnosis and causes. There's no specific test today that confirms you have Alzheimer's disease. Your doctor will make a judgment about whether Alzheimer's is most likely the cause of your symptoms, based upon information you provide. Alzheimer's is caused by brain cell death. The total brain shrinks with Alzheimer's. While they cannot be seen or tested in the living brain, it will show in the autopsy tiny inclusions of nerve tissue that are found between the dying cells. Researchers do not fully understand what leads to Alzheimer's disease, although several different factors are believed to be involved. Risk factors for developing the condition include aging, family history, and carrying certain genes. Some of the symptoms: cognitive, mental decline, difficulty thinking and understanding, forgetfulness, making up things, mental confusion, and irritability. Behavioral: aggression, difficulty with self-care, repetition of words, and personality changes. With mood: apathy, anger, general discontent, loneliness or mood swings. Psychological: depression, hallucination, and paranoia. And also common is inability to combine muscle movements and jumbled speech and loss of appetite. How does Alzheimer's disease affect the body? It affects the central nervous system, the brain and the spinal cord, the digestive system, swallowing difficulties and eating without choking, pneumonia from accidental entry of food and liquids into the airways, and bowel control. Neuromuscular system: they lose the ability to walk, maintain posture, and accidental injuries are related to declining motor functions. For treatments, there is no known cure for Alzheimer's disease. Alzheimer's medications can temporarily slow the worsening of symptoms and improve quality of life for those with the Alzheimer's and their caregivers. Adapting to the living situation: for someone with Alzheimer's, establishing and strengthening routine habits and minimizing memory-demanding tasks can make life much easier. Regular exercise: activities such as a daily walk can help improve mood and maintain healthy joints, muscles, and heart. Exercise can also promote restful sleep and prevent constipation. People with Alzheimer's may forget to eat, lose interest in preparing meals, or not eat a healthy combination of foods. They may also forget to drink enough, leading to dehydration and constipation. My personal connection to this is Jewel Benefield, my great-grandmother. She falls in the age range of 60 and above. She passed at 81. She would suffer a lot from the symptoms and causes I have just read, and here are some of the specific ones. She would always overexhaust herself, working outside, sweeping the porch, and continuously wiping a sink. It doesn't sound like much, but in Florida in the summer in 100-degree weather, outside sweeping, an 80-year-old woman. She would repeat words and phrases. I remember one time she would sit on the couch and there was a magazine for blueberry muffin mix, and she would read it to me and all the ingredients, and she'd put it down, and in about 2 minutes she'd pick it up and she'd do the same thing, and that would go on continuously. She didn't know who her family was. If I were to walk in, she would say hey and act like she knew me, but if someone were to ask her, who's that sitting right next to you, she'd just say, that lady from down the road, or that good old boy we all know. She could remember certain things about work in her past, and she would repeat it over and over again, but she couldn't remember things up to date, and she really suffered from malnutrition. She lost an interest in appetite and cooking, and she basically lived off of peanut butter or crackers, basically whatever was sitting on her table. Now switching gears to the psychological effects on the family members. Alzheimer's disease is called a family disease because watching the chronic stress of watching a loved one slowly decline affects everyone. Caregivers must focus on their own needs, take time for their own health, and get the support and respite from caregiving regularly to be able to sustain their well-being during caregiving. Some statistics. 83% of the help provided to older adults in the United States comes from family members, friends, or other unpaid caregivers. About 1 in 3 caregivers is 65 or older, and it is estimated that 250,000 children and young adults between ages of 8 and 18 provide help to someone with Alzheimer's. The responsibility of caring for someone with dementia often falls to women. Approximately 2/3 of caregivers are women, and more specifically, over 1/3 of dementia caregivers are daughters. Some of the causes and symptoms that affect them: they're in denial from the person that has the disease. They're angry or frustrated because that person can't do the things that they used to. They suffer from social withdrawal and anxiety and depression. Exhaustion because they have to complete someone else's daily tasks. They don't have time to worry about their own. Sleeplessness, irritability, a lack of concentration, and other various health problems. How does it affect the caregiver? Depression and mental health. Depression risks increase alongside the worsening cognitive symptoms of a person with Alzheimer's. For physical health, they are very susceptible to diseases and other health complications. The stress of care and transitions. Admitting a relative to a residential care facility has mixed effects on the emotional and psychological well-being of the family of caregivers. And strain. Many caregivers of people with Alzheimer's or other dementias have difficulty with medical and nursing-related tasks. For treatment, it's important to know the resources in your community. Adult day programs, in-home assistance, visiting nurses, and meal delivery are just some of the services that can help you manage daily tasks. It's important to use relaxation techniques. There are several simple relaxation techniques that can help relieve your stress. Get moving. Physical activity can reduce stress and improve overall well-being. Find time for yourself. Spend time doing things that you enjoy. Becoming an educated caregiver. The Alzheimer's Association offers programs that help you better understand and cope with behaviors and personality changes that accompany Alzheimer's. You may also find it helpful to talk to other caregivers in your area that are going through the same things that you are. Make legal and financial plans. Putting all of that in place after a diagnosis is so important. Having future plans in place provide comfort to the entire family. My connection to this is my grandmother. My grandmother and my great-grandmother were mother and daughter. My grandmother would suffer a lot from these symptoms. She always felt like she couldn't go anywhere. She had to be near to home. We didn't take any vacations with her, and she couldn't even take a day trip out of town. It was out of the question. She was torn between the care of her husband and the care of her mother. He has heart trouble, so dealing with that and then someone with Alzheimer's is very difficult. It did not help that she did not have equal help from other siblings. She has 3 siblings. They're out of town. They don't live around here, so that was very difficult. She suffered emotionally very much, very emotional, and still is. And now it's recently occurring. She has heart trouble, and we believe that's what it's from. You have to conquer loss before death. Really and truly, that patient is gone before they are dead. They're just not there anymore. A lot of her stress relief would be to walk and to dig in her garden. Possible questions you might have. What is the difference between Alzheimer's disease and dementia? Alzheimer's disease is a type of dementia. Dementia is loss of thinking, remembering, and it interferes with a person's daily life and activities. Alzheimer's disease is the most common cause of dementia among older people. Is Alzheimer's disease hereditary? Just because a family member has Alzheimer's does not mean that you will get it too. A rare form of Alzheimer's disease, called early onset familial Alzheimer's, or FAD, is inherited. It is caused by mutations or changes in certain genes. Most cases of Alzheimer's are late onset. This form of the disease occurs in a person's mid-60s and usually has no obvious family pattern. I personally believe that ours runs in the family. My grandmother, along with her other siblings and their parents, showed tendencies of Alzheimer's, and I'm actually interested in getting tested. I'll have to look more into that. And do men or women have a higher risk of developing Alzheimer's disease? Although Alzheimer's disease strikes both sexes, it is a disease that particularly affects women. More women than men die from the disease, most likely because women generally live longer than men. If you are interested and you want to learn more, you can visit the Alzheimer's Association organization and learn how you can become active and participate. Thank you. Are there any questions?